Hi there, and welcome back to the channel. Today, we're diving into a topic that affects millions of people around the world, but is often misunderstood. The difference between snoring and sleep apnea. Maybe you snore, maybe your partner does, or maybe you've just wondered, when does snoring become something more serious? In this video, we'll explore what causes snoring, what sleep apnea really is, and how you can tell the difference between the two. We'll also talk about symptoms to watch for, risks you shouldn't ignore, and steps you can take to sleep more soundly and safely. So, grab your headphones, get comfortable, and let's get into it. Snoring is the sound that happens when air flows through your throat while you're asleep, and it causes the relaxed tissues in your throat to vibrate. That vibration is what makes the snoring sound. It's more common than you think. Around 45% of adults snore occasionally, and about 25% snore regularly. Common causes of snoring include nasal congestion from allergies or colds, sleeping on your back, drinking alcohol before bed, being overweight or having excess tissue in the throat, a narrow airway, something you're just born with. Snoring can range from a soft puffing sound to something much louder and more disruptive, but in many cases it's harmless. Annoying, yes, but not always dangerous. However, that's not always the case. Sleep apnea is a serious sleep disorder. The most common form is called obstructive sleep apnea, or OSA, and it's very different from simple snoring. With sleep apnea, your airway actually gets blocked during sleep, often by the soft tissue in the back of your throat collapsing. This causes your breathing to stop completely. Sometimes for just a few seconds, sometimes for much longer. When this happens, your body wakes up, briefly, just enough to reopen the airway. You might not even remember waking up, but your sleep becomes fragmented, shallow, and unrefreshing. Some signs of sleep apnea include loud snoring followed by choking or gasping sounds, pauses in breathing, often noticed by a partner, waking up feeling tired even after a full night's sleep, morning headaches, difficulty concentrating during the day, irritability or mood swings. Over time, untreated sleep apnea can increase your risk of high blood pressure, heart disease, stroke, and more. Now that we understand what snoring is and what sleep apnea is, let's talk about how to tell them apart. Because yes, both involve noise. Both happen during sleep, but they are very different in terms of impact. Here are some of the key differences. Snoring is usually consistent in rhythm, caused by partial obstruction, less likely to wake you up, not always a sign of a medical issue. Sleep apnea is marked by pauses in breathing, often followed by choking or gasping sounds, can happen dozens or even hundreds of times a night. Leads to low oxygen levels and fragmented sleep. Is a serious medical condition. Think of snoring as a warning light. It's not always dangerous, but it can be a red flag, especially if it comes with other symptoms like daytime fatigue or gasping in the night. So how can you know for sure whether you just snore or whether you might have sleep apnea? Here are a few signs to look for, either in yourself or in someone you share a bed with. You stop breathing during sleep, even if just for a few seconds. You wake up gasping, choking, or feeling short of breath. You feel tired during the day, no matter how much sleep you get. You have trouble focusing or remembering things. Your partner says your snoring is loud and erratic, not smooth or rhythmic. Another helpful tool: record yourself sleeping. There are apps that use your phone's microphone to detect snoring and breathing patterns overnight. And if you wear a smartwatch or fitness tracker, it might show abnormal heart rate dips or low blood oxygen levels. And another sign to pay attention to. If any of this sounds familiar, don't panic. But do take it seriously. The first step is to talk to your doctor or a sleep specialist. They may recommend something called a sleep study, where your breathing, heart rate, oxygen levels, and sleep stages are monitored overnight. Sometimes this is done at a sleep clinic. Other times you can do a home sleep test using a device that monitors your body while you rest. If you're diagnosed with sleep apnea, the good news is it's treatable. Common treatments include CPAP machines, a small mask you wear at night that keeps your airway open with gentle air pressure, oral appliances, mouthpieces that reposition the jaw and tongue lifestyle changes, like losing weight, avoiding alcohol, or changing sleep positions. In some cases, surgery to remove tissue or correct airway structure. The key is to get help early, because untreated sleep apnea doesn't just ruin your sleep. It can affect your heart, your mood, your memory, and even your lifespan. Let's take a moment to recap everything we've covered today. Snoring is common and often harmless, but can sometimes be a sign of something deeper. Sleep apnea is a more serious condition where your breathing actually stops during sleep, and it often goes undiagnosed. The key differences lie in the pattern, the symptoms, and the impact on your daily life. If you or someone close to you snores loudly, gasps during sleep, or wakes up feeling exhausted, it's worth getting checked out. Better sleep starts with awareness, and the more you understand about your body, the better you can take care of it. Thanks so much for watching or listening today. If you found this video helpful, please give it a like and hit that subscribe button so you don't miss future videos on sleep health and well-being. And if you've ever dealt with snoring or sleep apnea, drop a comment below. I'd love to hear your story. Until next time, sleep well and take care of yourself.